I never like imagined I was going to go this route. When I was in NP school, the goal was graduate, get a job with a medical group and work as a hospitalist. I wanted to be in the hospital. And then it just so happened I was doing my first NP job. I worked at an internal medicine clinic. We were doing ketamine infusions, we're doing a whole lot of interesting things. So I had my daughter and I was trying to find what was my next step, what was my next move, because things did not work out with the internal medicine clinic. And then I was online searching, and then I encountered her on Facebook, and she mentioned how she was managing so many ALFs and she was doing mobile primary care. And I'm like, that sounds interesting. So I reached out to her and then I shadowed her for a little bit. And then I called her back. I said, I'm not ready.
Hello, friend. Welcome. I'm your host, Carlene Cadet Francois from Florida Assisted Living Consulting. Today, I am here with an amazing guest. But before we get started, I am from Florida Assisted Living Consulting. We help busy professionals convert buildings into thriving assisted living facilities and group homes. We are also the organizers behind the #1 Florida Assisted Living Caregivers Conference, annual conference every year. The next one is in January, 2 days conference, 23 and 24. Check the link in the description to learn more. We also build communities inside of the thriving community. We show up monthly to give you the one-on-one support that you need to help you achieve your goals. I'm about to get started, but before I do, please consider to like, subscribe, and share this video with someone that will find it valuable. We are trying to reach our first 5,000 subscribers. Okay, that's the goal that I have, and you can help me achieve that. Today, I am here with the amazing Rose Zamora. We are going to go over matter, addressing mental health needs and assisted living. Rose is a dual board certified family and psychiatric nurse practitioner and the founder of HyDrip Health in Plantation, Florida. With over a decade of hands-on experience, she's known as the nurse practitioner who comes to you. Rose works directly with assisted living communities to provide on-site medical, mental health, and wellness services that keep residents healthy, reduce hospitalization, and support caregivers. Her passion is helping ALF owners and teams address the whole person, mind, body, spirit, to improve both care and community well-being. Oh my God, Rose, I know some of my ALF communities, they're like, yeah, we need her in our lives because we hate to send our patients to the hospital. We don't want to know exactly what's going to happen to them. They get nervous, they get scared, we get scared, worrying about them. Rose, welcome to the show. I am so happy that you're here today. Could you please introduce yourself?
Yes, thank you so much for having me. I'm excited to be here as well. It is an honor. Like you said, my name is Rose Zamora. I am a dual certified family and psychiatric mental health nurse practitioner. So I've been a nurse since 2010 and a nurse practitioner since 2016. First, I started doing mobile primary care, and then I opened up my wellness clinic in Plantation. But I love my geriatric population, like the wisdom. It's just something about them. Although I am trained to work with children, but I mainly work with the geriatric population. And I do refer to myself and some of my colleagues as the nurse practitioner who comes to you, because we go to the patient where they are at the ALF and sometimes in the community. And our goal is to make sure that we are preventing hospitalization and reduce rehospitalization, right? Because we do know that when that population goes into the hospital, oftentimes they decline, right? So sometimes they're in the hospital for a long period of time and then they end up in rehab. So we're trying to prevent that by making sure that we are available to them. That's giving the facility peace of mind as well as that patient's family, because a lot of them have children that are out of state and they want to make sure that mom and dad is doing well. So we make sure that we are available. Not only are we available to see them, but we are available to the facility as well. So they're able to get in contact with us if something is happening, and we're able to go to the facility to see them. Recently, we've been doing the mobile flu clinic where we go into the ALF, making sure everyone have their flu vaccines. That way it's reducing the risk of them catching the flu this season. So I'm just excited just to be of service to my community and go where it's needed, providing a valuable service.
I love that. I know you can work with children, and I love the children too. But
I do,
when I
but I love my geriatric population.
Me too. Entering this business wasn't even my idea, it was my husband's idea. But once I started working with the older people, I was just
Mhm.
like, I am never going back. I am never
Yeah,
going
you
back.
can.
There's just something about being around them, the way that they love on you, or they hate you sometimes,
Yes.
but they don't hate you for too long. It's just for a
Yeah.
little bit of time, and then they love you again.
They are so grateful. They are so grateful
They
that you
are.
talking to them, you listening to them. And oftentimes, if it's my last appointment of the day, I'll just sit and listen. They
You
talk, they tell you what they did when they were growing up. Like, it's just their life stories. It's so much to learn from. I'm grateful to be able to, work with them.
I know the things that they share. Have you ever asked them, when you were X age, what did you
Hmm.
wish you would have done better? How did you
Yeah.
look at life? What
Hmm.
lessons you've learned now that you're looking in retrospective? I
Hmm.
mean, the wisdom that you get to learn.
Yeah.
I'm just like, I just want to sit with you. You can tell
Yeah.
me whatever you want, not just sit there. And it's just
Hmm.
so soothing. Have you come across situations like that where you ask them specific
Oh
questions?
yes, all the time. And it's mind like boggling just to hear their stories. And sometimes you encounter someone and you would have never imagined the life that they lived before. So and I think that actually helps you provide better care, right? When you know the
Mm-hmm.
person's story. So now it's not just, a 93-year-old male patient. Now this is Mr. So and so, this is what they did before. So your approach
Mm-hmm.
is different because now you're getting to know the person, not
Mm-hmm.
just their diagnosis, not just their chart.
Mm-hmm.
So it's like that's why you're able to provide that whole person-centered care because you know their history, not just their medical
Yes.
history, but their social history, how they live, how they,
Yes.
go through life. So I think that makes the world of a difference.
It does. And I think we can all gain something from sitting and just
Oh
listen,
yeah.
even if it's just for 5, 10 minutes.
Hmm.
Just legitimately listen to them.
Hmm.
Not only does it make them feel good, but you
Yeah.
come out learning something. You come out, at
Yeah.
least for me, I would come out a better person every
Hmm.
single
Hmm.
time. And clearly, I see your heart and your passion
Oh
behind
my
this.
gosh.
What
Yeah.
made you decide to go this route?
It's crazy because I never imagined I was gonna go this route. When I was in NP school, the goal was graduate, get a job with a medical group, and work as a hospitalist. I wanted to be in the hospital. And then it just so happened I was doing my first NP job. I work at an internal medicine clinic. We were doing ketamine infusions, we were doing a whole lot of interesting things. And then I had my daughter, things didn't work out. And then I met a colleague who was now we're sisters because it's a whole
Oh,
family
don't
now.
you love that when
Oh
you
my
find
gosh. When I tell you
someone?
things happen, God was ordering my steps. So I had my daughter and I was trying to find what was my next step, what was my next move, because things did not work out with the internal medicine clinic. And then I was online searching and then I encountered her on Facebook. And she mentioned how she was
Wow.
managing so many ALFs and she was doing mobile primary care. And I'm like, that sounds interesting. So I reached out to her and then I shadowed her for a little bit. And then I called her back. I said, I'm not ready. I said, thank you so much for your time. This is great. However, this is not for me. But as fate would have it, I was doing a program to kind of teach you the rope of things. And who did you
Mhm.
think they pair me up with to kind of show me the rope? Right?
Wow.
Exactly. And that was back in 2018. So I've been on the street in a good way.
That's
For a while
amazing.
doing this, yeah. And during the pandemic, I kind of went back to doing mostly wellness, but only to find myself back doing a lot of transitional care starting this past year and doing a lot of house call back to where it all started. And now I've added mental health into the mix because mental health is healthcare, so we have to make sure. But I feel like it wasn't me that was choosing, it was literally God that has been ordering my steps along the way. When I look back and I'm like, oh, so I was doing ketamine, it was preparation for what I'm doing now. Oh, I was doing this, it was all preparation. So everything kind of like work out how it was supposed to.
Wow. I love that. Years ago when I went to the sheriff's office and I'm like, I want to get to know like
Mm,
who I am as a person.
right.
I want to learn my spiritual self. And
Mm,
I somehow, and it's like talking about God ordering your
mhm,
steps. I
mhm,
believe my steps were ordered to be doing what
mhm.
I'm doing right now. And everything that I've done before led me
Right.
to here. And I came across African preachers and they were talking about destiny helpers. I
Wow.
was like,
Yes. 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 Oh my God. Those people, they're working on your behalf. Yeah. Because even with the flu clinic I mentioned before, it was like I've approached buildings. They're like, oh no, we have contract with pharmacies. But then gotta have people in place that are mentioning my names in different rooms. Like I've gotten 3 buildings, doing flu clinics for them. Had I gone just me, they're telling me, oh no, we have other contracts, but God has other people working on my behalf, you know?
I'm telling
favor,
you,
favor is not fair. No, it's not.
baby. Oh my God, you would
Favor
say
is
that.
not fair.
I said that to my daughter all the time. She said, oh,
Hmm.
that's not fair. And I'm like, honey, can
Favor
I
is
give you
not
some
fair. Yes.
examples about
Hmm.
what's not fair?
Yeah.
Favor is not one of
Hmm.
them.
Hmm.
I believe in life, we are all grouped to help each other out. We all
Yes.
carry the same type of anointing, and
Hmm.
you can see it in us. Like you start
Yes.
talking about what you do, I can literally see your anointing, and your
Yeah.
names are being mentioned
Yeah.
because of that. That
Yeah.
anointing you carry to this is your
Hmm.
life's purpose.
Yeah.
And it's so amazing to see your name being called in different
Hmm.
places. That means you're doing an amazing jobs out
Yeah.
there.
Hmm.
So at your clinic, what are some of the services that you provide?
So in clinic, we do a lot of preventative health. So we do IV vitamins infusion, wellness exam, blood work. We do STI testing, STD testing, annual wellness exam. We also do acute visits. So somebody who has maybe an upper respiratory infections, a UTI, and stuff of that nature. So we able to see them. Like anything you would walk, like a walk-in clinic, we can help you manage as well. So we do chronic care management here too, but most of our clients, are the younger populations where they don't have a long list of medical history. So our goal is to help them, continue to stay healthy and doing that. And I think when I started doing the mobile primary care, that's what prompted the IV vitamins and infusions, because some of the patients I was seeing, and I'm sure you've seen them as well, their list of medications is like a mile long. Those little folding table that people use to eat dinner when they're watching TVs. I've walked into a resident's room. He had at least 5 of them. They were all stacked
Wow.
with bottles of, pills. And I'm like, there has to be a way where we can be proactive rather than being reactive. And that was 2018. Started doing research. At the time, IV vitamins was not as popular as it is now. There was like 1 or 2 people that was doing it. So me and another colleague, we went to Atlanta, did a class, and then 2019 we launched the IV vitamins infusion clinic. So the whole aspect of staying healthy, prevent certain things, because there are certain things that we have, but there are things that we're able to prevent, right? Because if we're managing our weight, if we are making sure we're sleeping right, if we make sure that we're taking our vitamins and different things, so we're able to prevent some of the chronic illnesses that we're seeing in the younger population. Now we're seeing people younger and younger getting sick, which a lot of time you used to see people getting sick like that when they were in their 60s, but now 30s, 40s, you're like, what is happening? So that's the whole premise of being proactive rather than being reactive.
So I'm
And then,
telling you, how am I supposed to help you feeling like crap? I just can't do it. And no
mm-mm,
one can do it. You show up and,
no,
and you're struggling to focus. And
yeah.
you know what? I've been there where I've worked myself so hard and I
Hmm.
show up and I'm here, but it's like my mental space is
Yeah, you're
clogged
not. You're
up.
just there physically. You just you're just there physically. But it shows in your work too, like how you deliver care. It shows when you are empty. It's not the same.
It is not the same.
It's not
So
the same.
caregivers, please take good
Hmm.
care of
Hmm.
yourself. Even if you can't do it every day or every
Right.
month, find something that you can do for you, even if it's
Hmm.
going outside, walking, going to the beach.
Hmm.
There are so many free things that you can do that don't require so
Yeah.
much money. I love to see that you have a holistic combination of practice that will help to take care of the whole person.
Right.
When you talk about mind over matter for
Mhm.
seniors, what does that really mean in the day-to-day of life and also inside of the ALF?
Well, like 1 in 5 older adults experience like depression and anxiety symptoms. And oftentimes that's mistaken for like normal aging, right? Like we do vitals every day, but how often are they checking on their mental health? Say like a resident where they stop eating, for example, right? Automatically they will take action. But when Mr. So and so in room 128 doesn't come out to the activity room, or they're not engaging, or they just want to stay in their room, they just say, that's just normal aging. They're just not engaging as much. So we're not being, proactive. We're not taking steps. But if they stop eating, automatically they're going to call the provider, so and so is not eating. They haven't been doing this, doing that. So it's a matter of being more mindful of their mental health, right? So a lot of time we think, okay, yeah, mental health, we think about the 30-something-year-old, right? Oh yeah, they depressed
Mm-hmm.
like that, but older adult deals with the same problems. So
And
if you were
worse.
30, yeah, and worse, if you were 35, you had depression, you had anxiety, or you had other mental health, they don't just go away because now you are 75. So we have to make sure that we are continuing to monitor and manage those chronic illnesses. And sometimes it might be a new diagnosis. We just have to be on top of it rather than just referring to everything as like normal aging. So it's a matter of making sure that we're doing cognitive assessment. We're making sure we're going beyond the just, hey, they just redrawn, or they just, getting used to the space, or they don't like to socialize, when sometimes it's a mental illness that needs to be addressed.
Yeah, I love that. I don't have any nursing background, and I used to own an ALF because that's how I was introduced into the business.
Mhm.
So when I left the sheriff's office, my husband said, we're looking for things that I would actually enjoy. And he said, why don't you get into assisted living? I think you would really enjoy this. And so I opened my own. And one of my biggest insecurities were,
Right.
I'm not a medical professional. And so I don't
Mm.
want to let my clients down. And so if my client just didn't look normal, you would
Right,
get
right,
that
right.
phone call from me. If they
Hmm.
didn't eat more than half of their plate,
Right, right, right.
I was one of those that called the doctor a lot. So when you go into an ALF and then you guys are the medical professionals for the
Mhm.
ALF, what are some of the services that you provide for someone who's listening to this and who have no idea what you do? What do you do when you go into an ALF? What are the services that you provide?
So I'm going to answer that in two parts. So there is the primary care aspect, and then like currently there's a service that I provide that's like transitional care. So the
Mm.
primary care is your regular primary care. Just think of it as if you were to take mom, dad, or grandma, grandpa to a medical doctor. You were to go to a facility, they will do, the blood work. If they needed imaging, they will do that. They would listen to their heart, lungs, and do the head to toe assessment. It's the only difference is, rather than you transporting mom, dad, grandma, grandpa, uncle to the office, now we are coming to you. So we are doing everything that would have been done in the office, except it's being done at their convenience, at the ALF or at their home. We're still ordering labs. We're still ordering imaging. If there's like an altered mental status where we feel like, hey, there might be a UTI, we're still collecting a urine. We're still doing the culture. We're doing all of that. There's a mobile lab that's coming to draw their blood. There's a, mobile X-ray imaging company that's coming to do a portable X-ray at the facility. So that's what encompass all the mobile primary care. Nothing is missing. The only thing is grandma, grandpa don't have to get out of the facility. We go to them. And the second part is the transitional care, which I do a lot of. Is when that residents get back to the facility. Sometimes if they don't have a provider that comes to them, they have to go see their primary care. Sometimes there might be a delay because a lot of time they get discharged. There's home health orders. They need to do physical therapy to strengthen them so that way they're not falling, or maybe they have an open wound that needs to be addressed. So we go in as a transitional care provider to see them reconcile their medication, making sure they're not, missing any of their meds, and making sure that we are overseeing their plan of care. So there's no delay with physical therapy. If there's a wound that needs to be addressed, we're addressing that. So the whole premise is that there's no delay and there's no rehospitalization, because what we don't want is we don't want grandma, grandpa to fall. We don't want their wound to get worse, and then now they're going back to the hospital. So we see them, if we get a referral, we see them within 24 to 48 hours. We send the orders to the home health. Home health is coming in, physical therapy is coming in. Like the first week that they get back, there's a lot of back and forth. There's a lot of people that are coming. What I tell families is you would rather too many people come than nobody at all. Because so that way, that's one of the things that we do. So it's heavily on the transitional care. So if we go in as a transitional care provider, we don't take over their care as their primary because they already have their established primary. Our goal is to bridge the gap so they don't go back to the hospital and there's no delay in them receiving physical therapy or wound care or whatever the case may be. It's always based on what the patient needs.
I love that. I love that. I've had the opportunity to see that in action. Literally, everybody comes to the ALF.
Yeah.
Everybody comes, if it's X-ray, like you mentioned, if it's wound care, if it's, everybody is coming in. And if you're listening to this and you're someone who has an ALF or you're opening an ALF, prep your space for traffic, because you will have, depending on the health status of your clients, you will have different moving parts, and you have to be positioned in a way where you can receive the traffic, whether it's everybody coming in at once or, throughout the days you will have those traffic. And I love how you collaborate with different sectors that help you serve your client, right?
Yeah,
you mentioned mobile lab, you mentioned X-ray, you mentioned a lot of home health, you mentioned a lot of the providers that some of them even sponsored the last conference that we had.
Oh, nice.
And so when you can be in the room where you can meet all of those types of providers, you really get a chance to showcase and be able to help your client, because now you're not out there by yourself. And if a family member is listening to this and they're caring for mom and dad, perhaps they're a sandwich generation child, how does that look like for them in specific, for you going to their home? Do you provide that service as well?
Yes, I do go into the community, as they will call it, when the resident is still living at home or living with a family member. It's the same concept. We go into the home, physical therapy goes, or whatever service that client needs. So it's the same. We always try to coordinate with them ahead of time. So regardless if they're in ALF or at home, I try not to compound too many things at once, so that way if they just finished physical therapy and now I'm coming to do an assessment, like they're not engaging as much, so I'm not getting like a true sense of the patient per se. So I would either go before, or maybe I'll push my appointment later on that day, so that way it gives them time to eat lunch, to relax by the time I come in. So communication is the best thing, right? So when we're able to communicate, we can move appointments around. But it's the same concept. They get everything they would have gotten at an ALF. Lab comes, X-ray comes. There's no shortage because they are at home versus an ALF. I don't go in their home for mental health. Mental health mobile, I do. It's only at the ALF.
Okay. And I can understand why, because there is a licensed community. There has to be certain things in place. So, and it's part of your safety too, because what you do also have a safety aspect of it. And sometimes people can't empathize because they don't know, right?
Right.
Because you are also someone providing service, and there
Exactly.
are risks with everything.
Exactly.
So definitely when it comes to mental health, what are some signs and symptoms that ALF providers or even family members listening to this, because they may not have realized that this particular signs and symptom is of mental health related issues, and so they don't know, and so they can't take
Right.
steps. What are some advice that you would have?
Is to, is to pay attention to the clients from their day to day. Whenever there's a change, we say, don't just say, hey, this is like normal aging. You would rather you send a referral, you have somebody come in to do a cognitive assessment just to see what is happening. Because oftentimes we will say, hey, they have dementia, when in reality, it might be depression. So if they're not engaging as much, or maybe they're not eating as much, so they want to be in the room all the time, stuff like that. So we want to make sure that we are staying on top of those, just to see any change that is happening, that we're staying on top of it and we're following up and not delaying. Because you would rather you do an assessment and it was just normal aging than for you to delay and it was something more serious. So it's just to pay attention, to try to pick up those changes that are happening. Like, did they used to just be up early having breakfast, but now, they want to stay in bed. Even if you bring them food, they don't want to even sit up to eat. So what are, some of the changes that are happening, just to pay attention to those cues. Because I feel like our bodies a lot of time tell us, they're communicating. Are we picking up those signs?
I agree. And then sometimes too, you'll have, and this is from personal experience in managing an ALF myself
Right.
before I became a full-time consultant. But you will find a client that is suddenly so agitated, right?
Yeah.
And you're like, okay, the doctor's coming over. And sometimes a UTI, something as it's not simple, but it's not anything people think of a UTI. You're not going to be like, oh my God, this person is that. But a UTI can cause
Altered
so
mental
much
status.
issues. Yes, if they are not caught. Can you tell us a
Yeah.
little bit about, signs of UTIs and what should someone do about these?
Yeah, because I think a lot of time us, we know like the frequent urination, right? We can report burning, but an older adult is not telling you, hey, I'm burning, or I'm urinating frequently. And a lot of time, because they have on a diaper, you're not picking up on the frequency of it. So whenever they start getting agitated, or you feel like, oh, they're not like their true selves, whenever I get called to go see them, I always already order a urine culture ahead of time. Because I know a lot of them, oftentimes, they do have a UTI. I've had clients, it's like clockwork. Every 3 months, they will have a UTI. It doesn't matter what they do. It's like the quarterly UTI check-in.
Yes,
So
it's
whenever they call
true.
and say, hey, so-and-so, they're agitated, or it's like they're not themselves. I'm scheduled to see them like the next day, but I would order a urinalysis just to see what's happening. And like 9 times out of 10, it would come back positive that they do have a UTI. So I think ordering those tests will kind of like help us, eliminate certain things, right? Is it true like an altered mental status due to something else? Or is there a change because there's an infection that we can order some antibiotics to take care of it right now? Or is it something where they're going to need some medications for a long term? So that's where all the proactive comes in. And I think that's where all those other key players come into play, because you can send an order for urine. They can, the staff collect it and the company comes and pick it up and run it. Or if somebody fell, you can order the imaging. They come in and do the x-ray. So it's collective. It's not like a one person show. Like there's no way one person will be able to carry out all these things. But together, when we work in collaboration with each other, we're able to deliver like premium, superb care to those clients.
I love that. I feel, and this is out of watching my residents when I used to manage, I feel certain medications would give them those UTIs, like after a certain number of time, long taking it every day. And they don't like to drink water. Like you have to get creative for them to drink water. I feel part of the UTIs, especially the ones that get it faithfully, I feel the medication may have a factor to do with that.
Yeah, a lot of medication have side effects. And even sometimes you taking an antibiotic for UTI, you can end up with a yeast infection. So you have to get creative and be proactive about, hey, are we doing some yogurt? Are they able to do some cranberry juice while they're on those antibiotics? Are we able to do some probiotics and stuff like that? So yeah, you could be taking a medication that causes you to have other things. It's unfortunate. That's just part of medicine, where you take one thing, then you have a side effects, and then you have to take something. You have to take something
I
else
know.
for it.
I
So,
know.
but it's like you need that, so you have to, it comes with the territory. You just have to managing symptoms.
I know. We used to say, what's the lesser evil, right?
Right.
Yeah, because neither one of these choices are good,
Mhm.
but which one is the worst?
Yeah.
Which one is the
Yeah.
lesser evil? And you have to outweigh the bad. We touch a little bit about the emotional aspects of things. For someone who have an ALF, for example, how can they support their emotional aspect of their residents and also support the family members? And then to flip the coin as well,
Mhm.
how can family members and residents who are competent enough support those people who are caring for them at those communities?
And I think we mentioned about not pouring from an empty cup, right? So let's take the providers, for example. We have to make sure that the providers are well equipped so they're not burnt out. Because if they're burnt out, then they're going to be missing signs. They're going through the motion of things without being able to fully be present, where they can pick up on certain cues like, oh, yeah, Mr. So and so, he's not like himself today, and different things, right? If we can wave a wand and be fully staffed how it should be, right? Like life will be
Yep.
easier. Life
Mhm.
will be easier, but I think making sure that we have adequate staffing, making sure that we're doing in-service for the providers. So they're not doing the same thing how they were doing it 15, 20 years ago. Things are changing. And little things we can do are are they doing the PHQ-9? Are they doing the GAD-7? And there's like mini cognitive assessment that can be done on the residents, just to make sure like we are staying on top of things, and we're not waiting until they have declined so far, and that's when we're trying to intervene. It's not when the building is almost burnt down. That's when you're pouring water, right? So whenever you notice
Mhm.
that smoke, if we're able to put that fire out, so we prevent all those damages from happening. But I think it's just, as an ALF owner, if you have those providers, if you have those people where you can say, hey, I have a resident, can you come in and do an assessment? Can you come in and look at Mr. So-and-so? I think there might be something going on, right? So you don't wait until the person falls. Now they end up in the hospital, right? So they had an altered mental status. So now they get disoriented middle of the night. They try to get out of bed. Now they're on the floor and they are in the hospital. So if we could have been on top of it from when they declined from going to the cafeteria 3 times a day to not getting out of bed, if we can do those assessments, stay on top of things, try to prevent things from happening. So it's like making sure our staffs are adequately trained, we're doing those in-service, and making sure that we are referring right when we notice those changes, rather than just waiting until they've declined so much, they've fallen out of bed, and things have happened for us to intervene. Just being proactive.
I love that. I love that. Because if you are waiting until the building is on fire,
Yeah. Mm-mm.
literally, we're using that as a metaphor. You're losing your furniture, you're losing everything
Yeah.
that's in it. So that
Mhm.
means you're losing your
Exactly.
business. So take
And
proactive
from
measures.
an owner perspective, if the patient is not in the facility is not getting paid. We're looking at it from a business aspect. Keeping your residents in the facility is not just good for them, it's not just peace of mind for their family, but it's also financial security for you as a business owner, because now you're able to pay your staff. Because regardless if you like 2 residents short or not, you still have to provide adequate staffing. And they go per, I don't know the exact logistics, but those
You
numbers.
heard that, right? Because I know you guys be saying, oh, Cardine is always talking about business. Because I know my people, they will care for their residents like
Mhm.
with their eyes closed.
Yeah,
But you're also running a business.
right.
You're caring for someone, but that someone is also your business. That
Yeah.
someone is also your income. So when we say we hate for our residents to go to hospitals,
Mm-hmm.
because we want to make sure not only do we know are they going to get scared, they don't like new faces, but then we don't know what's going to happen to them.
Yeah.
And it also impacts the bottom line.
Mm-hmm.
So it makes sense for you to fully care for your residents, and it's okay to make a lot of money caring for people.
Exactly.
I think that's what we were created to do. We
Mm-hmm.
all need each other in different things you can tell me I wouldn't know. Like you said a lot of things here. Listen, you said, I'm glad you said that's a test because I didn't know what that was. Right? This is how this life is. We all need each other in different realms of this life.
10%.
And let's touch a little bit about the sandwich generation children. So, if you're a sandwich generation child and you're listening to this right now, any advice for them?
I think one of the key thing is to find a facility that you feel at peace with, right? We all know about like mom guilt when you're referring to your children, but the same goes for when we have to make sure like our parents are at a facility where they able to be taken care of, especially, we're busy going back and forth. We're not able to be present in the home as much as we would want to. And that mom and dad are not able to live on their own. So finding a place that, when you leave, you're not like second guessing, right? You have to be at peace with the facility that you've chosen. And it's okay. Ask questions. Ask as many questions as you can before you sign, before you said, okay, I'm moving mom and dad there, and find out what's the exit plan. If you have to move facility, what's the process? Because sometimes you might have to do that because everything might not what it seems from the beginning versus when they're leaving there. I think that's really key, having that peace of mind that, okay, that home, that ALF that I've chosen, I know they're going to provide the best care to my mom, to my dad, to my uncle, and whoever that family member. Having that, I think it's going to be like, give them so much peace versus like you having to call 3-4 times a day because you don't trust the people there. So making sure that you find a facility that you trust. And then the other part is where we come in as mobile service providers, because there are some facilities that already have provider there, primary care or whatever the case may be, is knowing that are there providers that are able to come into the facility? And if not, are there transportation that's going to take mom and dad to where they need to go? Once you have those questions answered, like I think that makes the process so much easier because you're not able to be there physically 24/7, but like their needs are being met. If you have to create a checklist, you create a checklist and make sure like they check off those boxes before you said yes. But sometimes it's inevitable. Sometimes you might have a parent that might have cognitive decline, where they have dementia, where they wander off, they leave the house. So you can't leave them by themselves. And maybe you're not able to pay for a 24-hour caregiver to be with them. So placing them in a home, as much as it hurts your heart, might be the safest thing for them to do, because if you're not a medical, you might not be equipped to care for them as well. And sometimes they might get sundown syndrome where they get agitated towards the end of the day. So there's a lot of things that that comes with it. But I think finding a place that you trust, like you feel at peace, it might never be 100%, because let's be honest, nobody's gonna care for mom like you care for mom, or you might have your different standards. But finding a place that you feel at peace, you feel at ease with, I think that's the beginning of the whole transition, to speak.
You said that perfectly. The only thing I would add to that is have those hard conversations early.
Mm-hmm.
Seek for help. Don't wonder, don't be out there by yourself. Help is available. But yes, having those conversations very early on and finding resources. We have a lot of in-home caregivers coming out to conferences. Like last conference we hosted, there was a lot of in-home caregivers, and they walked out with resources because you're able to not guess, not wonder, but then you have someone that you can call and double check on what is happening and you're not sure, because it's only a matter of time where you are not equipped. Even if you have a medical background, you may have other issues going on with your job, and then you can't leave mom home by herself. It's only a matter of time. But if you're well informed and you have
Mhm.
resources, and now you're better positioned to make the best decision. So thank you for sharing that. I think sometimes we can squeeze ourselves to the corner and then we suffer more.
Yeah.
You talk about bridging the gap between acute care and community. What systems or practices would make the biggest difference in reducing hospital readmissions?
Currently, what we do in the transitional care, I think that makes the world of a difference because those patients are seen right when they get out of the hospital or the rehab. Because a lot of time, they go to the rehab and then come back to the ALF. Because sometimes they're not scheduled to see their primary for another 2-3 weeks. So that's where we come in. And that's how I explained it to them. I said, I'm not taking over as your primary care. I'm simply a bridge to make sure that you're not drowning, just to make sure that services that you need. And sometimes it might be physical therapy, it might be occupational therapy, it might be nursing to come and make sure that, they're helping them with medication. And unfortunately, sometimes when those residents leave the hospital, they come back with a skin tear, they come back with a pressure ulcer, and we need to stay on top of that so that way it does not decline. So making sure that the home health have those orders to execute. And as you know, they can't do anything unless they have a signed progress note, unless they have those orders. And I've had families say, but the hospital, they say they recommended home health, but it's still not like an order where they can execute because there's not somebody that's overseeing that plan of care that's able to sign off on those. And this is where we come in as providers. We're not just certifying to Medicare that, hey, this is a real life person that they're billing on, but we also making sure that they're getting the services they need, physical therapy to strengthening them, nursing to come and do those education, making sure their medications is reconciled so they're not going without their medication. So that's where the prevention comes into place, where they're not back in the hospital because now they haven't had their insulin, the blood sugars through the roof. Now the facility have to send them back out. So just being there, seeing them 24 to 48 hours, making sure those orders are executed, making sure the plan of care is signed. That's where we come in. And although I'm able to be their PCP, when I go in, my goal is not to take over as primary care. And I tell a lot of providers that because they're like, oh no, but if you go in, you're gonna be taking my patients. Trust me. My goal is not to touch your patients. I want your patients to stay there. You continue to see them. I'm only there temporarily. I'm just a bridge. I'm just a bridge. I'm there for transitional care. I'm not there to take your patients from you. Trust me. I will call you. I will forward notes to you. I want to work in collaboration with you to make sure that your patients stay at that facility. Because just as same for the facility as a provider, if the patients are there, you're not able to see them, and if you can't see them, you can't
They're
bill.
paid.
So
Yeah, you mean that? I saw your body language.
yeah.
I read body language for a living, honey. Yeah, I saw
Listen,
that. You
I
mean
tell people
that?
that all the time. They're like, but you, and I've had to reorder business card, and I took off, like, I make sure, hey, I do a lot of transitional care. I do a lot of occupational health. Like, I let them know, like, I'm not here to take your patients. If anything, I'll send patients to you because there's a lot of time I will see somebody that just moved in that needs physical therapy and different things, but they don't have a primary care. And I will funnel those patients to you because I know you go out to that building as a primary care. The goal is
You see
it's not
that? Yeah, collaboration. I love that.
collaborations, 1,000%.
Yeah.
Hmm.
And there's enough for all of us to win.
Oh,
And
more
then
than enough. More than enough.
and you don't want to overwhelm yourself either. Just because I can take this level of work doesn't mean I don't want to take it. I want to be free. I want to take a nap during the day.
Listen,
I just don't want it.
I went to a Heat game, just looking around the stadium, and I'm like, if each person were to just get like one row, you would have more than enough. And imagine all the other people that are not in there. So when I tell you my goal is never to remove from somebody else's plate, if anything, here's a cupcake, here's some broccoli, here's some protein. So the goal is for all of us to win, and we can when we collaborate rather than trying to undermine the other person.
Yeah. I truly do believe that, because even as I do this, I help people get licensed for assisted living businesses, and I also host these conferences, and people reach out to me, and then they're surprised that I help them.
Right. No, because
They're
listen,
like, most people didn't even answer. And then and if they did speak to me, they didn't give me legitimate help. And I'm
right.
like, I can only take so many. And honestly, I
Exactly.
only want to take so many because
Mhm.
I want to be free. I want
Yeah.
everybody to have enough to go on. I'm happy where I am?
Mhm.
So I love that you put it out there, even though you can take the patient. You don't want to take the patient. As a matter of fact, you want to take some off your plate so you can
Thank you.
focus in that area that you're really good at, right?
Yes,
You know.
yes,
So, yeah, absolutely love that. And when we collaborate, we all win. The last
yes.
question I have for you is, I know talking about mental health, especially in different cultures, I'm Haitian, for example, talking about mental health could be the purple elephant in the room. How
Mhm.
can we normalize talking about mental health? And so, if we have someone right here in our family. Could you imagine you have someone right there in your family and you have all of this resources, and then that person is suffering in silence because we're
Right,
not talking about it? And so we can't learn what they're going through and then be able to help them.
right,
And you have all of the necessities to say, oh, come, let me help you.
right, right,
How
right.
can we normalize talking about mental health?
I think the first thing is to create a safe space, right? Because imagine if somebody tried to open up to you and automatically you shut it down. So if somebody were to come to you and say, "Hey, I'm having a hard time," and your answer is, "You are too blessed to be stressed." So we don't allow the person that space to even open up, because then now they're like, okay, why do I even want to talk to Carlene? She's just gonna remind me of how blessed I am. I never told her I wasn't blessed. I was merely trying to express how I'm feeling, how I'm having a hard time adapting to this new role. And I think for our parents or the older adults in our lives is to, we have to see them as human being. When we start seeing mom as she's just a girl as well, or dad, that's a
Mhm.
man going through life, we stop seeing them as this hero on a pedestal who's supposed to be able to carry so much, when maybe they've never had a chance to have a soft life. Now we want to live all this soft life, but maybe your mom never had a chance to be just a girl, because
Mhm.
growing up she had to be this, to be that, and then maybe she come to a foreign country where now she has to be like 10 times more of the things that she
Mhm.
was used to. So we have all this pressure due to adjustment disorder.
Yep.
She suffered from that, but we can acknowledge that, because mom was just angry, or mom was just irritated all the time, or maybe mom was depressed. So
Mhm.
starting to see the person as a person rather than this figure that we've built in our mind. Just allow the conversation to happen without judgment. When someone say, "Hey, I'm having a hard time," allow them to explain to you, rather than be like, "Ugh, what do you mean you're having a hard time? Like, you have electricity, you have food in your fridge, you have a car, you don't have bills, all your children are grown, we pay your," like allow the person to express themselves, so that way we can get to know what they're going to. Because the moment we shut it down, there's no further conversation that's going to happen, because they know you're not going to receive what it is that they're trying to tell you. Just
True.
don't be judgmental. Even if you're judging in your heart, just don't say it out loud. Allow them
Yeah.
to
Yeah.
just talk to you, or parents are human too. And they're going through this life for the first time. And sometimes we expect so much out of them. Why we expect, like, you don't understand me, but do we understand them?
Mhm.
Like,
That
oh,
is
but
so
I'm going
true.
through so much. Oh my gosh. Can you imagine how much more they're carrying? Because regardless
Mhm.
of how old we are, we're still our parents' babies. They still feel
Yeah.
responsible for us and stuff like that. So I think the first step is just creating a safe space. When someone try to tell you something, don't be so quick to answer. Don't listen to respond. Listen to understand. when you pause before you answer. Try to pause before you answer.
Yeah, I love that. I love that so much. I was actually on a Teams meeting and I happened to pick up a phone call.
Mm,
And I tried to discipline myself to
mm,
listen and allow the person to vent.
right.
They called you for a reason, right?
Exactly.
And if you can't find out what the reason
Right.
is and you
Mhm,
notice that they're complaining about something, what appears to be them complaining about something
mhm,
is their way of releasing or venting or letting it out. And it's a blessing to be that person that they can call and they
mm.
feel comfortable enough
To share.
that you can allow them to release what they are saying, and now they can and then go
Mhm,
to the world and go make a difference, right? It's a blessing to
yeah.
be that, but sometimes we just want to talk. So learn this.
Mhm. I've told people, and it goes the same when you're heated, right? It's to stand on your toes for 10 seconds before you, yeah, stand on your toes for, and then try to count to 10 because that gives you time to calm down.
Mhm.
Count to 10 before you try to, and just pause and process.
I
Pause
love
and
that. I love that. It
process.
was so much fun talking to you. I'm always so excited because I always end up learning so much. I see new perspectives. I learn from a new perspective. And it's always an opportunity. And I'm very grateful that you take time out of your busy schedule to spend the time here with us. Any last word for my audience?
If you are children that are looking for a place for your parents, know that it's okay. You're not a bad child because you're not able to be home. Don't feel guilty about it. And like Carlene mentioned, there are resources, there are people that can help you navigate the process. So accept help and don't try to do it on your own. Help is available. And then there are providers like myself who are available to go out into the facility, to go out into the home, just to make sure that mom and dads are okay. And and it's a three-way communication with you, the POA, maybe, and then the facility and stuff. So the line of communication is always open, so you are not left in the dark. We are here. I'm here as a resource. If you are like a facility owner that would like to collaborate, we would love to collaborate with you. Whether it's just to come and provide some vaccines to your residents, or maybe your provider is out of town and you need something done like right away, rather than sending those residents out, we can come in and do an acute care visit for UTI, or if they fell, they needs their leg bandage up and you feel like they're getting weak, maybe they need physical therapy, whatever the case may be. Our goal is to help you, and I don't know everything, but within my network of other providers, I am sure that I will be able to help you find the answers that you need.
You heard that, right? There's no way you let that go over your head. One of the ways that my services are so specialized, when a client, like someone who's opening an ALF, for example, comes to me, because I know everything they're going to go through.
Right,
I went through the licensing process myself.
right.
I got myself licensed with no residence, and then I fill up the place and money started coming in, staff and everything else. And sometimes not every provider is as
Right.
responsible as you would want them to be when it comes to like their schedule. They'll come
Right.
out and they're perfect with the resident, but then one day they're out of town, didn't tell you or didn't put someone in place, and this resident is having an issue and you can't find them. That has
Mhm.
actually happened to me,
Right.
where I'm reaching out to different people. Can I use your doctor? Can you,
Mhm.
Rose is telling you you can
Mhm.
call her. Although she's not going to take the patient from your provider, she
Right.
will help you
Mhm.
solve whatever issue that is.
Mhm.
That is gold. I don't even want to say what the situation is. I needed that doctor, okay? That doctor was out of town.
Right.
And trust me. So I love that you mentioned that. I love your heart. How can my audience find you?
So website is hydriphealth.com. All social media is HyDrip Health, Instagram, Facebook, TikTok, all of them, HyDrip Health. HYDRIP Health, just one word. They're more than welcome to 954-280-9944.
All right. Thank you for spending this time with us. I will see you in the next video. Please consider to like, subscribe, and share this video with someone that will find it valuable. Until next time, talk to you soon.